Hi, my name is Maria Barba, and I'll be discussing the impact of healthcare reform in America. The 2010 Affordable Care Act, commonly known as Obamacare, is of historical significance in America's healthcare system. It's a giant leap in restoring the system. However, it did had some economic implications. The government's main goal was to provide accessibility to all the population. In a way, it did succeeded by creating that platform, allowing the exchanges. It also had great provisions, eliminating the pre-existing conditions and also the expansion of coverage for children aged 26. However, we did have some additional provisions that created a dent to the economy. The MLR provision, the medical loss ratio provision, stipulates that insurance company must pay 80 to 85% of their revenue, insurance collected premiums, towards paid claims. The consequences of this provision was the exponential increase of healthcare costs, increase in premiums, and medical debt, which it became the one factor of filers of bankruptcy. We do have statistics that show the high percentage of filers are contributing their bankruptcy to medical expenses. So we understand the problem. However, there's two key players, and we need the government involvement and the individual or consumer involvement. There are some solutions. We have to regulate, deregulate, and take action. Some of the aspects that can give us the solution to this reform, we have to eliminate fee-for-service system and steer towards an outcome-based system. Now, this outcome-based system will incentivize the outcome instead of parting with a barrage of services that sometimes they only inflate the cost and may not even be necessary. It also is going to be preventing the overbilling practices. Another area to improve will be that can give us improvement will be repealing certificate of need programs, which are the con laws. So in this way, we're going to be able to construct a layout of accessibility for supply and demand, competition, and fair pricing. So the con agency normally regulates the introduction of businesses to be able to have an adequate saturation. Hospitals normally have their vertical integration, and this con agency tends to partialize and favoring the hospitals, of course, because they constitute a great asset for the community. But at the same time, they are limiting new businesses to go into that market. So they're not allowing a fair market for the consumer. So we understand that repealing some of these con programs can help us improve the healthcare system. Another aspect will be to innovate systems to create medical schooling affordable. So by affecting the costs, we're going to have a higher availability of health practitioners. We need fair remuneration, but also we need to do some regulations on the guidelines. There's an American Medical Association uses a guideline of the RVUs, which is a relative value unit, to translate doctor's visit into 15 minutes. So we need to be able to improve the doctor-patient relationship. By doing that, we're going to have so many advantages. We're going to have an effective plan of care, better use of resources, of drugs, of testing, successful outcomes, and at the end, we're going to have lower healthcare spending. The drug patent protocols is another area that has to be improved. And we need to be able to eliminate the misuse of these drug product patent extensions. So these are normally there and they only contribute to a higher cost. Another way to improve and lower the drug costs will be to implement research and development regulations that can help accelerate the introduction of new cures and new treatments. Of course, one very important aspect will be the negotiation of drug pricing, which is going to help the government with government involvement, get savings to the consumer. At the end, we have consumer action. So the consumer is a key player in the economy and need to be able to be part of it in a way that it will have to involve in evaluating, differentiating options, choosing the best options with the guidance of their health practitioner. So be part of the economy. Also, it's important to understand that healthcare and health insurance are not the same. So health insurance is just a finance mechanism. It allows the exchange. So basically, it can be compared to the usage of a credit card when buying products. It just allows the exchange, but then, of course, request the reimbursement. Finally, it's on us. Insurance reform did improve the healthcare system. It created more accessibility. It gave us great provisions, eliminating pre-existing conditions, expanding coverage to ages 26. Now, but the law is not perfect and is on us, all the stakeholders here, which are the providers, the insurers, the consumers, to be involved. We are at the forefront of a new reform, and it's all on us to make it happen. Thank you.